Welcome. You are joining us today for our weekly limited healthcare conversation and opportunity for you, a business in Boulder County, to ask questions, receive information you need to know about Safer at Home and future orders, and also provide feedback in coming weeks. My name is Corinne Waldow. I'm with the Boulder Chamber, and on behalf of the other chambers and economic development agencies in Boulder County, we want to welcome you today and thank you for participating. We also want to thank Boulder County Public Health for offering these opportunities for businesses to stay informed, stay involved in this time where there's so much uncertainty. So the more you ask, the more questions you get answered, the easier it will be as we move forward. As a reminder, these are weekly calls, and you will receive information on that in this, as well as emails following it. Please put all your questions in question and answer, and I'll facilitate those at the end. At this time, I want to introduce Jesse Rounds with Boulder County Public Health to kind of walk through the Safer at Home and some of the questions that are being asked in limited healthcare.
Thanks, Corinne. Again, my name is Jesse Rounds. I'm the Limited Healthcare Business Liaison for Boulder County Public Health. And just want to start with a quick thank you to all of you who are attending, as well as to the Chamber for hosting this. So as Corinne said, this is the limited healthcare update. We've had 2 sessions now, and this will be our 3rd. And I just want to use this opportunity to go over some information that we have, go over what we've talked about in the past, and then sort of answer your questions as best we can. So I'm going to do a little sort of overview, a refresher on the face covering public health orders, the Safer at Home public health order, and then provide some resources, and then we'll jump right into the Q&A. So just quickly, Safer at Home and where we are. This is going to be how we're going to be operating for some time until there's a vaccine and there's treatment. Safer at Home is really the best way for us to protect our community. That said, it will evolve over time as we understand better the impact to the community and ways that we can safely operate. There may be changes, but it's going to be a long-term situation. It's going to be months until we see significant changes. So the face covering order in Boulder County applies to both indoor and outdoor. When you are outside your home and you cannot maintain 6 feet of distance from others, you need to be wearing a face covering. Indoors, in stores, you need to be wearing face coverings. The exceptions are when it's not safe to be wearing a face covering, when you're alone indoors, and if you're a child under 12, and also health reasons, which I guess is part of that not safe caveat. So what is Safer at Home? It's really an evolution of stay at home. Staying at home is the best way to protect yourself. COVID-19 is just as contagious as it was under stay at home. We are allowing businesses to open with restrictions, and that's what we're going to go over today. This is a new world for all of us, and so we're all learning as we go, and that's why these conversations are so helpful. So what is limited healthcare? In the past 2 sessions, I had a really long list that I think got, it was so easy to get lost in the long list that I wanted to cut it down. It's really businesses allied with medical practices, things like acupuncture, physical therapy, optometry, podiatry, some types of massage therapy, and chiropractic. And it's really services that are provided as part of a prescribed treatment, medical treatment or medical treatment regime. And so what are the services that are provided by limited healthcare under Safer at Home? What's allowed? Again, healthcare related activities. If it's part of a service that's prescribed, then it's under limited healthcare. Elective procedures that occur in a limited healthcare setting, and any procedures that would require a patient to take off their mask are not permitted. So that's sort of a reframing of what I've written there, but just patients need to be wearing masks or face coverings at all times while in these businesses. So specific requirements for your industry, and I think where I'm sort of focusing here is how this is different from some of the personal services businesses. Employees must be wearing medical grade masks while in limited healthcare settings. And medical grade masks are just surgical masks. That's the other way to call them. And that's the guidance being given by the state. Surgical masks are required for staff. Patients must wear masks or face coverings at all times. Those can be cloth, masks they bring from home. And then I think the other big thing is that the public health order requires that exam rooms, that the spaces where you see patients need to be cleaned each time between patients, so that you have a clean space in which to see the next client. Just sort of a step back here before we get into more compliance questions, and this is sort of overall for everyone when we get into questions. Compliance with the public health order is mandatory. I'll mention that again later, but it really is important. We're working to provide guidance in these sessions, and really, if you are looking for specific questions about your business, about your space, it may be best to speak with an attorney to figure out how you can comply in the space that you have. So a couple questions we've had, and really just two questions that we get a lot in these sessions. One is the difference between personal service and limited healthcare. And personal service, I guess I'll start with limited healthcare. Limited healthcare is services that are provided as part of a medical treatment regime prescribed by a physician or happening in those sorts of environments. Personal services are you're more, they're not prescribed by a physician. They're massage that you want to go out and take advantage of massage opportunity. That's not limited healthcare, that's a personal service. And then reiterating the medical grade point, medical grade masks are surgical masks. Nothing more than that. They're not required, you're not required to have an N95 mask or anything like that. It's just surgical masks. Where to go for information? We have a lot of sources of information, and all of these groups have been trying very hard to make sure that we're sharing the same information. First I want to share is our website. I'm going to try and link us to that website here. So if you'll give me a moment, I'll click over to, so this is the covid19.colorado.gov website. This is the state's website, but it's got a ton of information for your industry as well as safer at home in general. One thing I like to point out at this point is that your businesses, limited healthcare businesses, have office spaces and have general open spaces, and you'll need to meet the requirements of those business uses as well as limited healthcare. So this is a great resource for that, as is this website, which is the Boulder County website. Provides a lot of Boulder County specific information, links to many of the same websites that the state provides links to. But we also have this space where you can look at our checklists, which I'll mention again in a moment, but I want to show everyone where they are. They're on our website here, and let's see. Oh, nope, doesn't seem to have worked. Oh, no, they're down here. So at the bottom of here, checklists for each type of industry. So I'm going to go back to my presentation now. So other sources of information, the Chamber of Commerce has been incredibly helpful for us to get information out, and they're sharing a ton of information. These presentations are all available on their website, as far as I know. And there's also the Small Business Development Center. Your industry associations have a lot of great information for national level guidance. The licensing agency for your industry, whether that be a federal licensing agency or DORA, the Department of Regulatory Agencies at the state, has a ton of information. And then also your city, your local municipality will have information as well. The compliance checklist, just quickly, compliance with the public health order is mandatory. We say that in every session, and I think it's really important that we repeat it all the time. The checklist, using the checklist is voluntary, but compliance with the checklist is mandatory. We consider it a compliance aid and a way to communicate to your employees and your customers that you are adhering as best you can to the public health orders. Also, there will be public posters, and I think Corinne is gonna share some of those public posters or a location to get those in a moment. Here again is that link to COVID-19 business guidance. And then in terms of enforcement, we're asking through these checklists for voluntary compliance. We're gonna reach out to businesses where we've heard concerns and let you know about the checklists and let you know about the public health order. We may at some point need to ask for specific businesses to adhere to the checklist and show us that they are following those items. And if we have continuous non-compliance, we may need to go to the county attorney to seek an order to close or a civil action. Those would be against specific businesses where we've tried as best we can to encourage compliance. So I just wanted to check in again on these office hours. I really like that term for these. These are both today and Thursday, as well as next week, the same times, all of these industries. And I did want to point out, I checked right before the session, the Spanish language session is not happening this Wednesday, but it is scheduled for the future. There was definitely interest, and we want to continue to provide that service. So check back with the chamber and with Boulder County about future opportunities for Spanish language interaction on these subjects. We definitely want to reach out to everyone in the community as best we can. Finally, your questions or suggestions, we'd love to have a conversation now, but if after all the conversation we have, you end up with more questions, you can reach out to us at this email address or call our call center and our industry liaisons, as well as public health experts, will have an opportunity to answer your questions. And that's all I've got.
Great, thank you, Jesse. I'm going to ask some of those basic questions we get asked, and I'll put you on the spot again, Lane, but we get a lot of questions about masks, and I think some of the questions are about what are some of the conditions in which someone can say they can't wear a mask? What do you do in that situation? And then how do you work with clients and customers who refuse to wear masks?
So my answer is going to be a little different for this sector than it has been for the others. So generally our ordinance talks about people need to wear a mask unless they can social distance. And it has a few caveats that if there's a health, mental, or physical condition that prevents people from wearing a mask, or children 12 and under do not need to wear a mask. For this setting though, it requires the patrons to always wear a mask. So there is not sort of an exception to that. So there is not any allowance for having a patron come in, provide a service where they're not wearing a mask. So that is different than some of the other sectors where, again, we're wanting people to do that. And again, encouraging people to make sure they're wearing masks as part of our mask order, and where they certainly are asking people, is there a health reason why you're not wearing it? That's kind of the extent of how much questioning you would do of people. You don't need and should not ask them about what their health condition is that prevents them from wearing a mask. That's again for our general mask ordinance. But for this specific sector, there is not provisions for the patrons not to wear a mask.
So, and we have a specific question. We have a pediatric therapy practice. Children under the age of 12 need to wear facial coverings in our practice for the therapy, correct?
So again, want to make sure we're not getting overlapped with a healthcare setting where this is a pediatric health setting where they are seeing patients for other instances. That is not what this sector is covering. So if you're a medical, dental, veterinary service, those are separate from the limited healthcare setting. So if this was some kind of physical therapy, that would be appropriate here. And then we would want to see that happen. Again, anything outside of that would need to happen in a medical practice where then there's other precautions that can happen.
This particular question came from someone who does more physical therapy for children specifically. And they said, thank you. You answered their question about children under the age of 12. When there are any conflicting ordinances or requirements, which one should you follow?
Has that ever happened? I'm not sure. You should follow the stricter ordinance, and I know that can be complicated. So as Jesse shared, we have a resource line, a call center to help people navigate when you're confused. We're doing our best to minimize the number of local ordinances that are happening, and we're doing our best to follow the state safer at home guidance. So you shouldn't see a lot of discrepancies between Boulder County and the state. The mask order for general population out in public is an exception, and there are some local municipal mask orders as well. But hopefully outside of that, we won't run afoul too much. But yeah, whatever is happening, and I guess this would also apply to your individual practices. If you have requirements for other personal protective equipment or other procedures that you need to do that are more restrictive, you should still follow those. So we aren't exempting that there's other precautions that various industries need to have that they need to take. You should still make sure to follow those.
Okay, there's a question about adequate ventilation. Is there specific guidance about what would be considered adequate ventilation? We have a normal HVAC system in a normal office building, but we work in offices that do not have windows that open.
There's not great guidance on that. I think you want to make sure your ventilation system is being maintained and that it's functioning as it's intended to do. Certainly looking at where you're having different procedures occur and making sure those spaces have good ventilation doesn't mean you have to have windows open at all times, but you really should be looking at that and making sure you have good ventilation flow. You know, we have a tier system of protection here. The spacing is our ideal, and then we have mask coverings. You know, we have screening to make sure people aren't ill. So we have all these layers that are trying to address these risks, and then ventilation is yet another one to make sure we're getting good air movement and not having droplets persist in that area if there is someone that's ill.
In previous webinars, one of your colleagues has talked a little bit about the difference between fans and air filters, and not all of those products are recommended, as well as not all air filters are made equal. Can you talk a little bit about that?
Yeah, so when we're looking at the filters for your HVAC system, there are filters, and you need to make sure your system is equipped to handle a higher grade filter, something that has a HEPA filter that will potentially filter viruses. Those filters do restrict the airflow, so there's kind of a trade-off there. You need to make sure the ventilation system is equipped to handle the higher level of filtration that's happening there. As far as fans, just to blow air around, you know, you really want to look at why you're doing that. That may or may not be a good practice to do. If you're blowing air that could have droplets of someone that's ill into areas that other people are occupied, that's probably not a good practice. If it's some sort of again, air filtration fan that is equipped with a filter that would filter for viruses, that could be an effective additional thing to add. It's not a requirement, but so again, looking at the purpose of why you're doing it, and then what is it actually accomplishing that's either helpful or not helpful.
Great. Do chiropractors and acupuncturists need a doctor's script to treat patients in limited healthcare places? I think people are still confused as to, do you need to have a prescription to operate, Or is that just the way to think about limited healthcare?
That's exactly, yeah, that's perfect. And that's a really good way of thinking about it. It's what category you fall into. If you are providing service as part of a medical course of action, a treatment, then that is limited healthcare. That does not mean you can't provide those treatments if you don't have that. It just means that your checklist at that point comes out of personal services, not out of limited healthcare. So I really encourage a lot of the businesses that fall into limited healthcare to look to actually come to the session at 4 o'clock. That is the personal services session, but also the checklist for limited healthcare and personal services available on our website. You can look at both. They're in a lot of ways very similar, but there are distinct differences that you will need to be aware of before you treat patients based on which category they fall into.
Yeah, I think, and Jesse really hit it there. I think the situations where you start to blur lines is where you offer lots of different services. If a chiropractor also potentially has a massage service that isn't specific to something that's prescribed by a doctor, that's open to anybody wanting massage. That massage is going to be treated differently than the chiropractic services. So it's really looking at the span of the functions that you're offering. But again, we're there to help walk through depending on what those scenarios are. So massage without, again, a specific medical requirement for it or a prescription, and being in that healthcare setting. So again, just because someone comes in with a prescription for a massage to a massage center that serves the general public as well, that's not the same as exclusive to a healthcare setting. And that's really where we're trying to focus here with the limited healthcare versus personal services.
Right. Another crossover question, which is about what if you're selling products, some therapy products, do you have to then follow retail guidance as well?
Yeah.
Yes.
Yeah. Make that a very simple answer.
Okay. So again, all that information's on the website. I did get a couple questions. This one didn't come in right now, but quite a few limited healthcare and personal services asked for the difference between employee health checks and customer health checks, and how you record that information, and the different ways what you need to record and how you record it.
Lane, do you want to try, or I'm happy to
go for it?
Give it a shot. Okay, so for employees, you need to be tracking over time, and you need to be checking there's actually a checklist on the website, another checklist that allows you to see all of the things you need to be sure of before employees come in. For customers coming in, you need to check their temperature, and you need to just ask if they're feeling ill. You're not going to be able to check them over time the same way you're going to be able to check employees over time. That's what I would say is the big difference between those two.
Where do you need to record the information on your customers? I've pointed people to the links on the Colorado site, the difference between the employee tracking form and the customer tracking information.
And those are the best tools we have right now for tracking those. And I can try and pull that up if we want to see where it is. I have not navigated to that in a while, so it'll take me a second. But
I have it. I can pull it up really quickly if you want.
Excellent.
All right, let me share my screen. While I'm doing that, Lane, could you talk a little bit about, people have heard the governor talk about May 26th. What does that mean, and what are the next steps?
May 26th is right now the next target date for discussion of is there another relaxation of orders, or what additional things will potentially be added to the current safer at home. That's the target date. Really, it still needs to be supported by our surveillance information of what's happening within the communities. What are we seeing for disease, and what is our healthcare system capacity? So the next target date is May 26th. That does not mean a guarantee that everything will be relaxed, but we do expect some changes coming, and certainly anything we hear, we want to use these forums to discuss that with the various sectors.
Okay, so I pulled up the page. This is linked to from Boulder County's page. It's the symptom screening page on the state site, so you can get there from Boulder County, but it has a link to an employee screening form. And then at the bottom is also the wellness screening, but Cami says you can use the same form for both employees and staff. Okay, so there you go. I shared that screen for you.
Thank you.
Okay, do we have any other questions out there? So how can people within this industry provide input and guidance, in greater detail for future orders, specifically as we move farther along in the safer at home and out of it in the future?
Go ahead, Jesse.
I mean, I guess at the most basic level, conversations like this, reaching out to our business email, that sort of thing. And then obviously there are structures higher than that at the state, and our public health director who are really making these decisions, who need to hear this information, and they're gathering from a much larger pool. But
yeah. All right, keep coming to these sessions. We'll ask you a question. All right, so we have a question a little bit about telehealth coverage. I'm not sure if you guys can answer this, but has anyone heard about extending the telehealth options? Specifically, insurance companies have initially said that 90 days of telehealth coverage would be allowed.
I don't have information on that, so I don't know that I can answer. We certainly can see if we can find answers and share that back, but I'm not aware of any information on that.
Right. So get that out of there. If there's no more questions, I'm gonna, we got a thank you. If there are no more questions, I'm going to let Lane kind of talk a little bit about a survey you're going to be asking me to distribute to all the attendees of these sessions about face coverings.
Yeah, it's face coverings and really our whole social distancing process and what's happening in the community. So we're very interested, especially by a business sector, how effective are the patrons. Your sector, it's really required. So we're hoping to hear 100% from the limited healthcare setting, but really we're wanting to see how many people are wearing masks. Are they social distancing? There's other sectors where this is a lot more applicable than maybe this one, but you think of grocery stores where patrons should be wearing masks and should be social distancing, but that may not always happen. So we're very interested to see what's happening within the communities, and so we want to send that out. Our target is Friday to get that out to the business sectors to see what they're seeing and what level of compliance or other particular concerns or issues they're having.
Great. And the last thing I'm going to do before we sign off is I'm going to share my screen one more time, and I'm going to share those posters that Jesse referred to. You'll see here that the links to all of the webinar materials we've sent post-webinar in the past, and I'll do the same for this one. Also on the Boulder County site, the Boulder Chamber site, as well as other chambers and municipalities, we have a toolkit of posters that follow alongside the requirements that are in the checklist. So, the social distancing, the wash your hands, wear a mask. And in particular, there is a poster that says open for business. And this is kind of your self-certification when you're in compliance with your checklist that says, I'm following the state and Boulder County's requirements. We've created it for the entire county. We've shared it through all the chambers and municipalities, and there's no real branding, no branding saying it's just Boulder, to allow you to put it out there to assure your guests that you are self-complying to those checklists. These posters are also available in Spanish, so the link was in English and Spanish. I got a couple questions this week on how do I get my posters translated? Well, we took care of that for you. So these are all translated and then available for you to print in 8.5 by 11 or larger but really to have out and give you the resources you need under the checklist. So if you have any questions about those, you don't get the links from me in the next couple days, just let me know and I will continue to share this information to you. With that, we have no other questions. I want to thank Jesse, Lane, and Alexander, who is behind the scenes ready to answer any questions as needed. I want to thank you for joining us today and for taking this time every week to answer questions, provide additional guidance and information, and to allow opportunities for feedback in the coming weeks. I want to thank the attendees for continuing to get the information on how to open safer, how to prevent the spread of COVID in our community, and how to keep both our health and our economy strong. And I want to thank the other chambers and economic developers for partnering on this to get this information out to businesses. Thank you. Hope to see you next week and stay healthy and happy.
Thank you.
Thanks, Corinne. Thanks, everybody.